how you feel. So quiet laying next to me. A silent souvenir, letting you go, letting you go. Keep craving you the days that you don't want me. Like searching for some heat inside a cold breeze. On and on forever, won't you hold me? Now won't you hold me? Oh.
Good morning guys, how are you? So this video was actually supposed to be about essay crisis. As you can see, I am in the middle, fully in the middle of a full-on essay crisis. It's been a really busy couple of weeks. My granny passed away. One of my grannies in Northern Ireland, my granny Mac. She passed away. She had a dementia, Lewy bodies dementia. She passed away on the 12th of February, just before my birthday, and so we've just sort of been trying to get over that. Then our cat Henry, our little girl, our baby girl, you guys know that we've not been able to have a family, so our little baby girl, she had a crisis and ended up in hospital, and got taken from our local vets to the vet hospital, and she is newly diagnosed as diabetic. So I've been she's got a little tube in her neck, and I've been having to tube feed her for 6 times a day, every 3 hours type thing, and give her insulin twice a day, inject it. Obviously my past career in you know, the medical field has helped a lot with that, but it's been really distressing to sort of see your little fur baby so poorly. And yesterday she actually got very, very poorly again and went into ketoacidosis because the diabetes is unstable, and she's ended up back in the hospital. So we've had the nightmare of pet insurance. All I can say is please, please, please insure your pets. We had a previous episode with her years ago and hadn't insured her, and after that we very quickly learnt our lesson. So I think so far we're at £6,000, and we're likely to spend another 3 with this. Luckily it's covered by the amazing pet plan this time round, but all I can say is please insure your pets, it's so worth it. So we've been dealing with that. There's just been a lot going on really. It's been a nightmare, hasn't it? So what did I want to talk to you about today? Coronavirus. Right, so at the beginning of January I heard about this on the news, and I instantly thought, ooh, that's not good for people like me. So if you guys are new to the channel, then I'll just sort of give you a quick update. So I'm Dani, by the way. Hello, welcome to my channel, and hello and welcome back to all my usual regular followers. I'm Dani, and I have an immune disease, a couple of immune diseases that mean I have very, very little immunity. I tend to get recurrent respiratory and kidney infections, so pyelonephritis and pneumonia. I've had this since I was born. So Great Ormond Street, you know, some people with this disease are able to be given immunoglobulins to treat it or to help make them a bit better. That's not true in my case. I can't have that. I'm just waiting for somebody to drive off. It's so annoying when they drive past and they're like, oh my god, are you talking to yourself? I'm like, yeah. That's not true in my case. I produce antibodies to my own immunoglobulins, so basically I just end up having like a anaphylactic reaction to it. So there's no point. So there's no treatment other than to treat my infections with antibiotics as and when I get them. Unfortunately, after 37 years, the antibiotics are not working as well as they used to. It's taking about 5 or 6 IV antibiotics to knock things out of the park these days. The pneumonias are getting worse. The IV antibiotics are needing to be for a lot longer. The hospital admissions are being a lot more frequent and a lot longer. The damage to my lungs that the pneumonia is leaving is more profound, and same as with my kidneys. Very breathless a lot of the time these days. It's just a nightmare really. Yeah, and of course I get viruses too, and there is no I have been given antivirals in the past, and sometimes I have been given antivirals in the past. Sometimes they have helped a little bit. However, as we know with corona, it's COVID-19, antivirals do not work. One of the things that worried me about this virus was the at-risk group of people, so people like me. So I also have lung disease from having so many infections called bronchiectasis, which is kind of similar to cystic fibrosis, in that I need to do chest percussion and drainage to help get the secretions off my chest so that they don't become infected, although there's no genetic sort of link with bronchiectasis. It's from repeated infections and immune diseases. So I'm definitely in that at-risk group, although I'm still only 37. I remember thinking about it and thinking, yeah, that could definitely be a problem for me, because the people, when it first appeared in China, a lot of the people that were susceptible, the reason they were dying was because they were getting pneumonia. And because they had other sort of factors going against them, they were unable to... so these people were getting pneumonias that were susceptible, and they were dying because of it. So that had been one of my biggest sort of concerns. So I took steps in early February to limit my exposure to large groups of people. I was advised by the GP that I had to be really careful of going to university. Again, public transport, I'd get the train to Winchester. Again, public transport, I get the train to uni, buses, things like that. Large groups of people, lectures. So I had to make the decision to not go. This coincided with the university strikes at my university. So I was in the same position as a lot of people, bar a few lectures. So it wasn't terrible. But it's not ideal with the exams just around the corner, just over a month away. Not ideal at all. So it's all been going on. And yeah, so I haven't really been going out at all. Just the odd trip to the supermarket, and we did see family that were visiting from France. But I've been pretty much already on self-isolation in our house, what with the cat and everything, so I haven't really been going anywhere. However, we did go to London for my birthday to the Tutankhamun exhibition, so I probably was exposed to a few people there, and although we did get Ubers and things rather than the tube, we've taken every single precaution, you know, hand washing. As an ex-surgical scrub practitioner, ODPs, I feel pretty confident that I know how to wash my hands. One of the very first lectures that you get in uni, and one of your first sort of basic OSCEs, is Basic 101 hand hygiene, how to scrub, how to wash your hands, social hand washing and surgical hand washing, and then how to sort of gown up and lay up your trolley and maintain a sterile field. So I'm pretty confident that I'm okay with hand washing. Mike's pretty keen on hand washing, little bit of OCD with hand washing in our house. So we were quite well stocked actually, because we went to the supermarket at the weekend, and it was ridiculous. There's just no toilet roll, there's no hand soaps. That's ridiculous. This has got to stop, this hoarding and sort of stocking up, because what about the poor people, the elderly, and people that can't get to the shops, the people that don't have the internet? You know, there are people that can't financially afford to stockpile, and they still go to the toilet, they still need to wash their hands, you know, they have children who it is better to give a mini hand gel, not sponsored at all, a mini hand gel. It's better to give kids something like that and say, very simply, you know, you need to gel your hands when you go out to play at lunchtime, because hand washing isn't easily as explained to children as a little bit of gel, plus it's coloured and cool and they might use it more. So I think all of this stockpiling, and pasta, why would you need that many packs of pasta? That's just ridiculous, and it's so selfish. There was a man in Sainsbury's and he literally took 8 trays of Dove bar soap because there was nothing else, and I was just like, that's so selfish, you should be ashamed of yourself. And I was just like, you know, bar soap is not that hygienic anyway, so I just hope he's sitting there at home with his 50 bars of soap, looking at them thinking that was a bit dumb. Anyway, so update time. This is the thing I wanted to talk to you about. I have got a cold, which I think is progressing towards the flu. I'm feeling pretty grotty. I've got a headache, I've got a cough, aches and pains, dry cough, the nose, all of the usual symptoms that you get, a headache, just feeling really, really rotten, really. And it could be that it's this time of year. I certainly, because I'm so exposed, I'm so prone to infections, that it could be that it's that, or it could be that I've come into contact with somebody and I actually have coronavirus. Yeah, great. The one thing that I've been trying to avoid, so we've been told to self-isolate. So despite the fact that I bought these ages ago, we obviously have been told now by the government that they don't do that much. They're kind of a breeding ground because of the soft, moist air for bacteria. However, if there is somebody in your house that has coronavirus confirmed, you should wear a mask when dealing with them, and they should be wearing a mask around you, basically, to barrier protect. And in a hospital, that's how you barrier nurse, with all the PPE equipment. So, what did I do? Yesterday, I obviously woke up feeling like this and thought, okay, a little bit worried. Have possibly been in contact with people from a foreign country. I have possibly been in contact with people in London on public transport. So there's a chance that I could have been exposed to this virus. Now, obviously, everybody's saying keep calm, don't panic. And it absolutely is right. That is absolutely true. You should 100% follow the advice that is out there. However, people who are immunocompromised like me are going to feel a little bit more scared about it, because you know that the antibiotics don't work. If you get pneumonia, you know that the antivirals aren't going to work. So all they can do is support your system. And there's all this talk about, not being enough intensive care beds or HTU beds or even ventilators. And I am seriously concerned about that. So yesterday I followed the advice. So the advice was to go onto the 111 website. I took a self-directed, I'm so breathless, I took a self-directed online sort of exam type thing, an online questionnaire that went through about 10 questions, and it was basically all based on travel. Have you been to this place? Have you been to that place? Have you been to China? Have you been to Italy? Blah, blah, blah. Malaysia. And of course, all of my answers are no. And I found that this is where the problem in the questionnaire lies, that it cuts you off there. It kind of chucks you out and says, well, absolutely, based on the questions that you've answered, you're going to be fine because you haven't travelled anywhere. But I think we all know now that there are cases happening that have not come from travel. These people haven't been to Italy. These are people that are just doing their everyday life in Worthing or Winchester or London, So I think the virus is out there now. So I think the government and the NHS and 111 service need to update that, because that's not entirely correct anymore. I think it is not helping people get diagnosed. And I think the fact that they're not testing people in this country, in the UK, unless they're showing symptoms, is going to majorly affect I know that there's an end point for the amount of tests that the labs can do. However, if you only test the symptomatic who've been somewhere, not just the symptomatic, how are you going to get any accurate numbers on the actual stage of the virus and the projection of that? So you can compare it to where Italy is and where China was 2 months ago or a month ago. So that kind of kicked me out. So then I rang the 111 number as advised to. And it was the same thing. Have you been here? Have you been there? If you're worried about coronavirus, press 1. If you want to talk to them about something else, press 2. Tried the first one, worried about coronavirus. Again, went through the same questions. If you haven't been to these places, you'll be fine. Please check the website for more info. Not helpful. No option to speak to anybody. Option 2, so I thought I'll ring the regular 111 service as if I was just going to say, I'm not very well, what should I do? And explain to them, I need to talk to you about the fact that I'm immunocompromised. Went through that option. 3.5 hours I was on the phone with still no answer. So at that point I was getting really worried, so I hung up the phone, redialed the 111 number and pressed the option for, yes, I have been to one of these areas, which I know is a bit naughty, but I just wanted to speak to somebody. And hey presto, they answered the phone straight away. I'm not sure if it was a qualified person. This is what I'm unsure of. I'm not sure if these are qualified practitioners. or nurse practitioners or advisors, or if it is just an advisor. She seemed quite young. She didn't seem to know too much medically. I'm not sure. That could be completely untrue. She could be a very experienced practitioner, so, you know, I apologise, but she didn't seem to know too much really, which was a bit worrying. I sort of explained my situation, that I have maybe been in contact with people from a foreign country who've maybe been in contact with people that would have been going to Italy. I've been to London, I've been on public transport in February, so there's the chance, just like everybody else, that I've been exposed. However, I do have this condition, which means that I am highly susceptible to get this and get a much worse version of COVID-19 than the average person would. So yes, the average person is going to get the like cold-like symptoms, but mine could be very much worse, and I'm concerned about that, quite rightly, I feel. And she just kept putting me off, really. She was like, I think if you haven't travelled, you'll be fine. I did put my foot down and say, look, I'm in the medical profession, which I never do this. I hate to do this because it's horrible, and if you're in the medical profession and somebody says, I'm a nurse, you know, I know what I'm talking about. I've googled it, whatever. No practitioner likes to hear that, you know, because it's your clinical judgment. However, I did feel like she was not taking me seriously, so I did drop the I think I know a little bit more than you card on this scenario. Mostly, I think I know a little bit more as a patient, 37 years, who's had this disease. You need to take me seriously. So once I explained that I've only recently got over my last pneumonia in December, which left me with a partially collapsed lung, that, you know, I have to have a lot of IV antibiotics, that I am immunocompromised with an IgA and IgM deficiency and other sort of SID type immune disorders. I also have a heart condition and my kidneys and everything else. She did sort of go, oh right, okay, that is different, so I'll pass you on to a doctor. So I spoke to a doctor who said, yeah, absolutely, you should be getting tested in your, because of your comorbidities basically, and the fact that you are symptomatic. So they basically asked me to, very quick and simple, they took my name, date of birth, telephone number, and they asked me to self-isolate. Luckily I have some masks at home. Asked me to self-isolate. Luckily we're quite prepared. We'd already done a shop and things like that and put loads in the freezer, sort of in the last month really. Every shop we did for a week, or every week I bought a little bit extra rather than stockpiling like people are doing now. I just bought a little bit extra each time, and we should have enough to get by. So they've asked me to self-isolate, and they just said that somebody will get back to me within 48 hours at the latest, which we're now past 24 hours. So I really hope that somebody gets back to me soon, because I'm getting a bit worried and I'm not feeling too great. So should that somebody will get back to me within 48 hours in regards to getting me tested. So that's the other thing. You go online, there's so much to read, but there's nothing really definite to tell you what to do. So you see in Northern Ireland that they seem to be doing it right. There's sort of assessment areas where you can go to the hospital car park and the nurse comes out all PPE'd up and test you. And I know that the results can be back as early as 3 hours in some cases. I know that some hospitals here in the UK have testing pods. So she said you might have to go to a pod, or they might come to your house. Now I'm freaking out, thinking that at some point in time there's going to be this big truck turn up with people getting out in hazmat suits. Obviously it's the greatest safety to the public, so I would just go along with it. But I'm a bit worried about that. I don't want people to be sort of like judging me, because, you know, I have tried really hard to not be around people. So the fact that I'm the person that's ended up possibly catching it is just, it's so me. It's so typical. I'm so extra. But complicated even more. So basically that's where we are. So I'm now waiting for a call to say that how they're going to test me. So it'll just be a swab in the nose or the mouth, or a sputum culture, blood test, or I think they can do a feces sample. That's how they diagnose you. As you know, there is no sort of treatment other than supportive treatment. So I guess if I was to get pneumonia, then they would have to support my lungs with oxygen and things like that. I'm just feeling quite unwell at the minute. I've got a fever. starting to develop. I'm quite happy to be here at home. You know, thank God for box sets. That being said, it is going to put a massive interruption on life. I mean, the cat's in the vet hospital, and I would very much... I'm worried about being able to go and get her. I'm worried about family. I'm worried about friends. I'm worried about uni. I'm worried about not being able to go to uni. I have an essay due tomorrow, and with all the strikes and everything, I have been a real procrastinator. And with Granny dying and everything else, totally my own fault, but I think with the strikes I got out of my routine, and also where I've been self-isolated, I haven't been able to get to the library to get the resources. I've got a really big library file now, I think, so it's just not ideal. So I've got this essay to try and hammer out tonight, and I want to try and get it done now because I'm just worried that I'm gonna get sicker as the days go on, or the day goes on, and not be able to get it done. So I'm going to try and get that done tonight, and obviously I'll update you tomorrow when I've been tested. I'm worried that I'm going to get... I know that there's not a lot of centres down here that are dealing with patients with it, so hopefully they'll let me stay at home as long as I stay well. I am worried that I'll get sent to one of these hospitals, you know, not near here, and that Mike wouldn't be able to visit me and things. I've had to cancel 2 makeups this week, 2 makeup jobs, which I was really looking forward to. I've got an interview on Saturday, which I was really looking forward to doing about our TTC journey, which I'll have to cancel, and it's all so shit. And then you've got the worry that you may have, you know, given it to your family and other friends and things, and I have tried really hard to not be around people just in case, because I knew that this would happen. I knew that I was at risk of getting this a little bit more than other people. I'm ready for life to go back to normal now. So what am I doing? Basically, I am lemsipping it up. Fun fact to remember, guys, make sure you stick to the guidelines for paracetamol. Remember, children under the age of, I think, 15 shouldn't be given aspirin. Maybe it's 12. They shouldn't be given aspirin. Remember that paracetamol advice, so no more than 8 in 24-hour period. That includes things. So I once had a patient that had very nearly taken an overdose and very nearly died. He needed a liver transplant in the end. And it was a very, very horrific thing to watch. He got very, very poorly because he was a businessman. He just wanted to keep going throughout his day, and he wasn't aware that brand names like Lemsip meant paracetamol. I think he just saw cold relief and went for that. But so basically anything that's Beecham's or Lemsip, whether it's a hot drink or tablets or a suspension, they contain paracetamol. You need to be careful if you're on anticoagulants, if they contain aspirin, same as ibuprofen ones. You know, just be very careful. Don't give ibuprofen to children with chickenpox. It makes it very, very dangerous for them. It can make the rash hemorrhagic and bleed. So just be really careful with paracetamol that you're not taking a Lemsip as well as taking a Lemsip drink and then taking Lemsip capsules as well as something else containing it. Just be really, really careful. I can't stress enough how it only takes a few over the amount to be overdosed, and it can be fatal. Really, really fatal. So just be careful. So I'm just sort of keeping my temperature down with paracetamol. I've got some Lemsips to help my throat. I've got some lozenges for my throat. I'm taking my steroid inhaler, my blue inhaler to sort of relieve, nebulizers. I haven't got the oxygen at home anymore, so I might need some of that. Haven't got antibiotics, but the GP is looking into whether I should be started on some just in case it's a different type. Might not be corona. If it is just a genuine chest infection developing, then they might work. They're probably looking into antivirals for me, but just general advice: stay warm. You know, stay cool if you've got a fever. Self-isolate. Hand hygiene and just general hygiene, really. So I've been sort of using Dettol wipes to wipe down the door handles, the TV remote, anything that I might touch that Mike might touch and come in contact with. I'm cleaning the bathroom sort of every day, boil washing the towels, separate towels, and probably going to sleep in a different room from now on until we get the word that I'm A-okay or not. So yeah, so that's all you can do, I guess. And I know that people think it's a real big sort of bit dramatic, but I can't stress enough that it can be very serious for people that are at risk. So just take care of your family, that whether they've got diabetes or high blood pressure, COPD, other lung conditions, or like me, immune diseases, or people that have had chemotherapy, people that have had transplants or on cyclosporin, they're all at risk. So you need to be extra careful. So this is the case. Yes, we're now highlighting now. It worries me that like people are now only taking hand washing seriously, and it's just like, were you not hand washing before? It's quite worrying, really. But just be advised, if you are around people like me that are immunocompromised, I say this to my friends and family all the time. It may be that you have to say to me, don't come today to the party or whatever. And if there's a good reason for that, so if you say, oh, we're all sick here, we've all got the flu, I would far rather you tell me and me not come that time than have me turn up, be in the same room, because yes, your flu is going to clear up in a few days. Mine is going to turn into very serious pneumonia, and like every time I get it at the moment, it's kind of like, it's worrying. How many more times can my body take this? It is really worrying. I'm like, you know that I am not in any way, I've had this for 37 years, you know, I'm well used to it. I got quite a dark sense of humour about it. Especially being in the medical world, you know, everybody develops a bit of a dark sense of humour. You have to cope. You know, I've had way worse things happen to me. You know, I've had a stroke, I've had a heart attack, I've had a tumour removed from my bowel, I've had some really rare infections. I've been through it a lot. And yet, I'm really worried about this. So, if I'm worried about it and taking it really seriously, then I hope everybody else out there will too. But yeah, I guess the main thing to say is if you follow the advice, it's really important to self-isolate and stay self-isolated until they tell you. Just follow all of the advice and ring 111 if you're worried. Don't go to your doctor's surgeries. Don't go to the local hospitals. That's all you can do, I guess. But follow me on Instagram at Daniela_Logan_makeup, or my university Instagram is at medieval_universitygal. I'd love to hopefully hear from you guys on there, and you know, I'll be posting stuff. Obviously need to let people know if I've got it or not. I hope people aren't going to be dicks about it. I've literally, my friend told me that her husband was coughing the other day, and somebody said, oh, have you got coronavirus, and like basically took 10 paces back and was a bit of a knob about it. I hope people aren't going to be like that. I think we all need to remember the hashtag, especially this week with, you know, dear Caroline's funeral. In a world where you can be anything, be kind. You know, I think the human race needs a little bit more kindness. And this thing with the supermarkets, just remember your neighbour. You know, if your neighbour needed a toilet roll, just be neighbourly, you know, and friendly. And what the country needs right now is to come together and be supportive and just throw kindness around like confetti, as the saying says. You know, I think that's what we need. So try and help each other out, and yeah, so I will post stuff on Instagram to update you. So we've just got a little harvester dinner, and we are watching our favourite box set, The White Queen. Perfect for history lovers. So, welcome to isolation day 2. So I have managed to get my essay in, yay, on time as well, with an hour to spare. Currently on the phone to 111. So the bad news is they're telling me that it's gone from 48 hours for a test, to wait for a test, to 7 days because so many people are needing them, and they're getting a lot of people phoning up who don't need them. So I've explained obviously my condition and everything like that, and you know, need for getting tested. And unfortunately the person I'm speaking to is a non-medical advisor, so it's had to go through to somebody else. So that's where I am, waiting for
for calling.
Only half an hour on hold? Yesterday it was 3 hours on hold. Obviously so many people that need testing now, but so they advised me to ring an ambulance, which I think is highly inappropriate. I'm not going to do that obviously, but obviously today my symptoms are awfully and it's gone to my throat, it's gone to my chest, I'm now coughing up a productive cough, so let's see if I get tested today. So, just a little update for you. So, 111 obviously a few days ago advised that I should be tested. Wait 48 hours. Didn't hear anything. Then 7 days. Then I was phoned back by 111 saying it will be up to 7 days. Then I was phoned back again saying that they are now, due to the government recommendations from Boris's press conference, that they are not testing anybody, even symptomatic people. Roll it out basically. That doesn't help people like me. People like me, I feel like the at-risk people with immune diseases and all sorts of other conditions are being put at risk. Those are the people that should be tested. They should be tested at home, supported while they're on self-isolation, or admitted to a specialist unit if they need it. So last night was just a complete shit show really. The 111 doctor said, yes, your symptoms are not good. You obviously have got these underlying conditions. You're getting worse. You're not feeling great. So my advice to you is to walk into an A&E, which is in complete contrast and contraindication to what they've told us to do with self-isolation. So in the end, they sent an ambulance, which is just highly ridiculous when it could have been used for somebody having a heart attack. Even though I am still really poorly, it felt for me as a health professional really inappropriate use of services. 7 hours wait in A&E. They were running out of masks. They were not properly barrier nursing. There was people in that room that I could hear were being given possible diagnosis, confirmation of COVID-19. I was in a room that was specifically for people being tested for COVID-19. There were people off cruise ships, there were people that just had woken up with the sniffles. It was a real range of people that should have been there and people that shouldn't have been there, that were kind of overreacting to everyday sort of like symptoms, but could probably have managed just by self-isolating. Had bloods and an x-ray done. They were like, you know, basically we're only swabbing people that we're admitting to the hospital. If we admit you, it's not good for you because you're going to pick up every other bug going. So best to go home and self-isolate. X-ray and bloods aren't terrible at this moment in time. And I'm like, yeah, but we know that this is how my illnesses start. They never look terrible at the beginning and then they get suddenly very much worse. So on a hard trolley with very little updates, wasn't good at all. Finally got home, told to self-isolate. We got home this morning at about 6 AM. As the day's gone on, I'm feeling much worse. This is now day 3 for me of self-isolation anyway. So I've had the bugs that I believe I've had symptoms since Sunday night. I'm feeling awful now and I'm now coughing up green phlegm. So it's definitely respiratory. And I just feel like it's floundering. Like, you know, their focus is not right. If the Irish government are closing schools, we need to be protecting people. Yes, the country needs to still function. I feel like they are really focusing on the loss of GDP and things like that. I just think they are not. So, and on the TV, we're getting conflicting advice, but I'm being told by health professionals and untrained 111 call handlers, unqualified people, different advice. There needs to be some clarification, especially for people in the at-risk group. I get completely cut out of that group because if I don't answer the question that I'm over 65, well, sorry, Boris, you can be at risk and under 65. You can have health conditions. There are plenty of us out there, and we are seriously concerned that we're going to fall through the gaps and we're not being looked after at all. So the advice from the hospital was, come back if you get worse. Phone an ambulance if you get worse. Possibly infecting people on the way. So I'm now self-isolating again. I just think it's all really crap. But everyone's been super lovely, offering to drop shopping and food and things. So that's, you know, seeing some nice sides of humanity today. But I feel awful. I've got basically symptoms. I still have the headache, the sniffle. So the people saying runny nose, I still have that. The dry cough has gone more on to being a productive cough. So, you know, all of this aches and pains, usual flu-like symptoms, all of this could be for me the usual seasonal flu that I get from other people's colds and the usual seasonal pneumonia that I get, or it could be COVID-19. It would be better for me to be swabbed to rule that out, whereas if I get sicker, they'll know it's bacterial and can give me antibiotics, but I would need to be in a hospital for that to happen. I'd have to get to the hospital. My worry is that people self-isolating, they're being told to self-isolate with these conditions like myself, are going to self-isolate to the point where they don't go in time. They stay at home until they're too poorly to be looked after properly, and it has an impact on their life. As Boris not so tactfully pointed out, we are going to lose loved ones before their time. Well, it's also, I just hate the... And I also hate watching the news at the minute to see that another MP or another sports personality has been tested for the disease and has come back positive, but regular people are now not being tested. It's not right. So we're gonna get a takeaway. We've been advised with the takeaway that to put in the comments box when you do Just Eat or something, to put please leave on doorstep and ring the bell to let me know it's been delivered. So I have masks, we have plenty in the house for food wise in the freezer. Luckily, because I've been self-isolating, I haven't been in contact with many people, so there you go. Not ideal timing with essays and presentations and coming up at uni, and exams are due. Just feel really, really overwhelmed. I'll also talk to you tomorrow, guys. This is day 3 of self-isolation done. Hello, so we're now on day 4 of self-isolation. It looks like I'm going to be 14 days because I'm so symptomatic. I'm still really angry that they won't swab a vulnerable patient like me. They're only swabbing people that are admitted to hospital. It has definitely gone to my chest. I'm coughing up a lot of not very nice sputum. The bottom of my rib cage really, really hurts. Got a lot. The flu-like symptoms are still there, but they're not as bad. So that is getting a bit better. Really, really breathless. Temperature's still coming and going. I've still got chills. Sort of feel hot and cold. It's still very achy. But I guess the dry cough's going, and the nose side of it is probably a bit better. My throat feels a bit better today. So I guess what I want to say is I don't want to scare anybody with this, because my point of view is for patients like me who are in an at-risk vulnerable category, who have an immune disease from my point of view, or a lung disease, you know, who are very at risk from this. From what I can tell as a healthcare professional, the people that are getting it, and we've seen cases on the news of people that have recovered already, and lots of people are making a recovery. So I guess if you're out there and you're normal, you have a normal working immune system, I wouldn't be too overly concerned about this. You know, just follow the government advice. If you have symptoms, stay at home, self-isolate, don't go anywhere for 7 days. Take all the precautions that they've said, whether it's through the Department of Health, NHS England, or the government website. It is good advice. Obviously keep washing your hands, using the hand gel, catch a sneeze, bin the tissue. Just general precautions. I'm just wiping down all surfaces, door handles with a Dettol wipe or spray. Cleaning the bathroom after each person in the house has used it. I'm boil washing the towels each day. So I'm just trying to minimise the spread to, well, it's only Mike in the house, but I'm just trying to minimise the spread. I am starting to feel already right now, I'm starting to feel the self-isolation thing now. Like, it's been quite a nice day this morning. It was blue skies. And I would really like to have just popped out for a little walk just to get some fresh air, which I would normally do when my chest feels like this, but I can't. It's Saturday, just feeling a bit bored now really, so I do have some work to be cracking on with. I'm so glad I got that essay in this week. Even though I was feeling really poorly, I'm really glad that I persevered and knuckled down, because, you know, I just, like I always say, I just don't want my illness to affect every aspect of my life, and it does all too frequently, but if I can push through and get something done, I do like to. I don't think the essay is going to get a great mark because I was so poorly, but do you know what? I got it in. I'm happy about that. That's Mike. So I'll talk to you a bit later. Day 4. Oh, I'm not feeling very well at all. So I'm going to end this vlog. I'm hoping that I don't get much worse, because it'll mean I have to go back to hospital. Quite breathless. Just don't understand why they're not testing at-risk people with symptoms. And it is really isolating, actually. I know the word is self-isolation, but the idea of not being able to go out is really strange. So I'm going to end this vlog, guys. That's Mike telling me there's no toilet roll in the shops. Stop panic buying, you idiots. I will update you in a few days, guys. Take care. Bye-bye. Stay safe.